I mean, it's extremely gratifying to have a couple that has been struggling finally get pregnant, get that positive pregnancy test, and know that they're going to meet their child one day. Reducing sugar and your certain oils, like that's one big piece of like developing a healthy microbiome.
I'm passionate about people understanding, what needs to be done pre-conception to have a healthy human created. And so that's why I'd love to figure out a way, even within Crowd Health, how we can help women do some of this preconception work. Hey everybody, welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health. We get the joy of hosting thought leaders who are reimagining how healthcare is delivered. We're excited to have Dr. Ari Calhoun on the podcast today. Dr. Calhoun is a perinatal and pediatric naturopathic doctor and a certified functional medicine practitioner. She's most excited about pediatrics, preconception, and everything to do with the brain of our little ones growing up. Welcome to the podcast. We're excited to have Dr. Ari Calhoun on the podcast today. I'm especially excited about this for a couple of reasons. One is, and Dr. Calhoun and I we're just talking about this. We got personal experience with kind of perinatal issues, but also the company that I run, Crowd Health, we have lots and lots of pregnancies, which is fun. And lots of pregnancies at home, which I know you've had a couple natural births, one being at home, correct?
Yep, I had my first one in a birth center, almost at home, because my husband believed me we were ready. And then my second one was at home. Mm-hmm.
Yeah, that's so fun. I tell this story often, I think, through the podcast, but the last number that I saw is 1.6% of births in the United States are at home. At Crowd Health, it's about 40.
Oh, wow. Really
So it's
cool.
We have an incredible group of people who are very, very interested in, just the details around birth. And I'm really interested in what should people think about before getting pregnant, right?
Yeah.
Like, what do women need to do to get their bodies ready to be pregnant? And that's one of the things I'd love to focus in on today.
Yeah, absolutely. I love this conversation. And so my background was in fertility, and I helped couples get pregnant. I have my own kind of infertility struggles, and that was really exciting. And there's nothing it's extremely gratifying to have a couple that has been struggling finally get pregnant, get that positive pregnancy test, and know that they're going to meet their child one day. And at that same time, kind of I transitioned at some point. I know this seems like, how did you go from this to this? But I transitioned to pediatrics, but primarily in the realm of neurodevelopment. So with autism and other types of neurodevelopment disorders. And kind of in the midst of that transition, I realized that these two worlds are really intimately connected, yet the medical society doesn't see them that way. And it's not enough to kind of stop with my fertility clients and getting them pregnant. Really what we need to be focusing on is how can we kind of take that to the next step and support the health of the future generation, because so much of neurodevelopment and those kind of foundational steps to our offspring's health is laid down in utero. And, to take that a step back, there's definitely some work that can still be done in pregnancy. And it does take working with a provider that feels comfortable, because if you were to go online, everything is like not enough research in pregnancy, not enough research in pregnancy. But we can actually take more than I think, your Western world is going to tell you. But there are certain things that we can't do in pregnancy, and that in order to set that foundation up, it needs to be done prior to pregnancy. So the areas that I really focus on with my own patients are, one, gut health. We know that the microbiome, a huge part of that is passed on through our vaginal delivery, and that kind of lays those keystone species down for baby. But also our gut is, at this intersection with our immune system, which is like another really big piece that I focus on with moms. So what's going on with our immune system regulation? Do we have autoimmunity? We know that that is a risk factor, and we want to do as much as possible to get that autoimmunity in a state of remission, in a state that's, quiet going into pregnancy. Asthma and atopic conditions like eczema we work on as well. So the gut, the immune system, nutrition. And I was one of the founding formulators for Needed, which is one of the leading perinatal nutrition companies. And that is such a huge passion of mine, because it's not only about the fact that we are building another human and we need adequate nutrition to be able to do that properly, but these nutrients also are there to combat the inevitable toxin exposures that we're going to encounter, or the immune disturbances. So they're protective as well. Environmentally, toxins. I mean, I try not to cause too much stress in this area, because the truth is we just do live in a toxic world and we can't avoid every exposure. It's going to happen. But where can we put our safeguards up? Where can we support our bodies? Where can we just acknowledge that these are simple things that we can do to minimize and kind of reduce our exposures to some of the things that we know that impact fetal development. And, those are kind of the big ones. So nutrition, immune health, gut health, and nutrition. And then there's some other things that are just relevant to that person, around and their pregnancy experience, or previous pregnancies, or family history that we work on a little bit more in depth, whether it be mental health or history of blood sugar regularity issues and such.
Seems like that first kind of group that you talked about, they're somewhat or maybe very much interrelated, where it's nutrition, microbiome, toxins, all of those things.
Yeah.
What is your recommendation for women who are trying to get pregnant in kind of those key areas? So maybe what should we be eating?
Yeah.
How do we avoid toxins in this toxic world? And how do we think about our microbiome? There may have been a fourth there that I missed, but what is your advice to women who are trying to get pregnant?
Yeah. I mean, I think, some people need deeper work. So I always do an intake and try to find, within these categories, do we see that there are some imbalances already occurring? So within the gut realm, are we dealing with IBS? Are we dealing with, SIBO? Are we having recurrent vaginal yeast or bacterial vaginosis infections? There are some signs that there's clearly a dysbiosis. We have digestive symptoms, and then those individuals might need deeper work. They may benefit from antimicrobials or antifungals or antiparasitics and things that kind of help to be a little bit more aggressive at normalizing this ecology, because those are things we can't do in pregnancy, or we really don't want to. I mean, we can't use some of these harsher antimicrobials or antifungals with some level of risk. So we want to be able to do that and identify those problem areas and address them prior to going into pregnancy. But I think all of us, I mean, no one has a perfect gut. We all have different, imbalances here and there. And it's a constant work in progress. I think a lot of patients will come, they're like, okay, well, if I do this, am I done? And it's no, you're never done, because we're going to encounter things in our environment that's going to slightly shift our microbiome a bit. And so it's how can I kind of set up those safeguards and support this constantly evolving ecology? But, we want to push it towards these beneficial species. And really, the crux of it is diversity in our diet. How can I incorporate as much diversity in these plant-based fibers as possible? So fruits, vegetables, whole grains, legumes, nuts and seeds. These are the foods that are going to have positive impacts on growing a number of different species. And we want diversity. We want a healthy, number of different types of species within there. And we achieve that through feeding them a bunch of different things. And we could narrow that down. We could talk about certain compounds, these compounds called polyphenols have become really popularized recently. Polyphenols are found in our deeply pigmented purple, blue, red hues. So pomegranates, blueberries, blackberries, olives, olive oil, black grain rice, red quinoa, those are rich in polyphenols. And what's cool about polyphenols is that they act as prebiotics for the good bugs, while at the same time acting as antibiotics for some of the bad bugs. And so those are things that you can do wherever you are in this journey. If you're 3 months pregnant, or you're trying to conceive in the next year, this diversity in our diet, these polyphenols are shown to be supportive for a healthy microbiome.
Okay.
And then at the same time, reducing sugar, which is great time to talk about that. Reducing sugar and, your certain oils, that's one big piece of developing a healthy microbiome.
Where do you fall out on the seed oil controversy?
Yeah. So, I mean, I think that they shouldn't be like a huge part of our diet. I hate to villainize any food. Like, I really feel as though I also come from like a background with eating disorder and restrictive eating and
Hmm.
orthorexia. And so I like to believe that, like, again, all can be good in moderation. But yes, like, definitely not a preferred food. I think that there is a balance here. Like, omega-6s are necessary. So we can't, villainize these like fatty acids altogether, but
Yeah.
there are better fats. There are
Mm.
better oils to use.
Okay. I love that. So it sounds like there's some work to if you want to have a healthy pregnancy, it is probably a good idea to do some work up front, right? With someone like you. Um, does a woman go to just kind of any OBGYN, or what does a woman look for in a
Yeah.
doctor to help her walk through this prior to getting pregnant? Is this seems like a different way of looking at kind of a proactive approach,
Yeah.
proactive preventative approach to, some of these neurological conditions that you've been talking about.
Yeah, so I think like there's one part of this in that, Western medicine in general is not super proactive. So
Right.
we're not going to get what we
There's no
need.
money in proactive.
Yeah. We are but really, like, you don't have to necessarily seek out a specialist in preconception support to be working on things to help fortify a body that's going to be a good environment for a baby to
Mhm.
grow. I think anything that's going to benefit your health is then going to benefit the child's health.
Mm.
But there are definitely providers like myself that are a lot more specific about certain like objectives or metrics that we're looking at, that we know, like, this nutrient needs to be to this, or we don't want, X, Y, or Z. That, because, there's a little bit more that goes, there could be a little bit more that goes into this. But for most women, it's just kind of taking a look at yourself and understanding, like, what am I experiencing? What are the symptoms
Mhm.
that I'm experiencing? And is there a way that I can shift my diet, my lifestyle, that would be more supportive of a healthier me? And that's going to be, yield a healthier pregnancy and healthier offspring. So
Right.
I'm a naturopathic doctor. Obviously, I love all of my naturopathic doctor colleagues. And I think that any, naturopathic doctor is going to be looking at an individual and addressing these foundations. But there's a number of functional medicine providers out there and functional nutritionists that have great knowledge and, also great abilities to support women in this preconception time period.
I love that. And one of the things that we're really focused on is operating outside of kind of the traditional medical experience. And one
Yeah.
of those is operating outside of traditional health insurance. And so the question for a lot of people who watch this is, does health insurance pay for something like this? And if not, what is something like this cost somebody on average for this preconception work that has to be done or should be done?
Yeah. I mean, I think it's
I'm
different for
putting you on
everyone.
the spot.
Yeah. Like, do I know the numbers? So no, the medical system does not pay for these services necessarily. And a lot of the testing is not covered. There are certain things for sure that I do. And if I can get them run through insurance, I do run them through insurance. But it's not, it's always with the caveat in that I see this as medically necessary and relevant, but your insurance company may not. So
Yeah.
we're going to, like, do you want to go out on a whim and give it a try and risk a potential, like, huge invoice, or do you want to do this cash pay? So
Yeah.
the vast majority of what I do is cash pay. And, the cost it's not as predictable as, like, this perinatal care by a midwife, right? So like midwifery, we can say we're going to cost between, like, it's going up now, but it used to be around like $5,000 a
Yeah.
pregnancy or something like that. And that's obviously like substantially, I don't know why insurance companies don't cover midwifery, because they'd save a lot of money, right? Versus like going to the hospital, but
Yeah.
they don't. And but with the care that I do, it is so variable. So some of the moms that I see, it's just like they just want an overview and it's just one time cost. Other moms, we have to do a lot of deep work. So it could be thousands of dollars because we're doing lots of,
Mhm.
visits and testing and et cetera. So that one's harder for me to kind of like quantify. It's just so variable with the individual. But the end of this is that no, typical insurance does not cover any of this. And so it's cost prohibitive for many families, which is I think trying to strategize and figure out how we can work around this, because I believe in it so much. And I want more families to have access to it.
Yeah. And I think it's that's right. And as I mentioned, I feel like I'm kind of passionate about this preconception thing, because as people who listen to the podcast know, that my wife and I had a daughter with anencephaly, and found out that my wife had MTHFR. I don't know exactly what the variation, so that she can't metabolize folate correctly, and the lack of folate does lead to neural tube defects, and which was anencephaly is. Yep. And so I'm passionate about people understanding, what needs to be done preconception to have a healthy human created. And so that's why I'd love to figure out a way, even within Crowd Health, how we can help women do some of this preconception work. And so, maybe that's a further conversation.
Maybe it's another conversation.
The two of us. So what are there anything on the supplement side? You said you kind of mentioned a supplement before.
So, nutritionally, right? Yeah. And so this is also going to potentially vary depending on genetics and like what we might need more of. And I think that's why it's helpful to have just an overview of like, where are areas of vulnerability? That's kind of where it's like, where are
very personalized then
pillars? A little bit, but not necessarily. So there's definitely, so I help formulate Needed. They're one of the leading perinatal nutrition companies out there, and I help formulate their prenatal. And so what is often going on with prenatals, and if you go to a standard OBGYN, they'll say it does not matter what you take as long as it contains folic acid. And that is just so far from the truth. And obviously in your situation, just that simple recommendation for folic acid is not enough. When you can't metabolize and create methylfolate. And so what we aim to do is not take what's what's the minimal necessary, but how do we kind of comprehensively support a mom, given the fact that many moms these days are on restricted diets. Many moms these days don't have the best gut microbiomes and might not be absorbing their nutrients. Many moms are dealing with nausea and vomiting and not able to eat the diet that they were prior to pregnancy. And how do we ensure that even if they're not eating the best diet for them, like they just can't for various reasons, they're supported? We're covering those nutrient bases and more. We're not just covering what's necessary for baby to grow and develop and come out with 4 limbs, but how do we grow and support their brain development? And, beyond that, how do we support mom and her mental health and her body? And so Needed is not the only company out there. There's a couple of really great perinatal nutrition companies that are doing this comprehensive nutritional support. And I think that this is important not just within pregnancy, but we know things like choline and folate are incredibly important in the 3 months leading up to pregnancy, because you need adequate amounts of these nutrients in the very beginning of the weeks to prevent neural tube defects. So this is really important to begin. I always recommend, if we know we're kind of trying to conceive, that prenatal is begun at least 3 months prior to conception.
Yeah. The work that I did, especially after we lost Grace, was these neural tube defects. I think this is day 23 or 23 to 25. So this is like 3 weeks after conception, early, oftentimes before you even know it, and so it's like, do some of these things before you get pregnant, because they will have benefits. I love that. Needed. What is the website for that?
You know what? I want to say it's just needed.com, but I should look and
we'll put it in the show notes. Because that sounds
Maybe
awesome.
This is needed. This is needed.com, I think.
This is needed.
Yeah.
Okay. A good prenatal is needed. So this is needed.
Yeah.
There you go. Okay. So, conception happens. What are the things that you're thinking about as a doctor, as a woman is, pregnant, building this incredible human being in her? Like, what are the things that you're really focused on for her to make sure that, baby comes out and brain is functioning well, What are the primary kind of variables that you look through?
So I'm happy you asked that. And I think that there's a couple that are maybe obvious and then some that are definitely
Mhm.
not obvious and not talked about. I think one of the things we haven't talked about yet is that thyroid is really important in those
Okay.
first 16 weeks of gestation. And so prior to mom getting pregnant, we want to make sure that her thyroid is in range.
Okay.
And just for like an example, your primary might say your thyroid is in range if it's anywhere between your TSH is anywhere between 0.5 and 5. They might say like, oh, that's normal. But in pregnancy, we know that TSH needs to be below 2.5. So the range
Okay.
shrinks by like half. And we need to check that. And a lot of OBGYNs are just not checking that. And we know that low thyroid, especially in early gestation, can lead to neurodevelopment concerns and other, more major concerns with the offspring. So thyroid is one of the first things that I'm kind of fine tuning. And if a mom is already struggling with hypothyroidism and she's on thyroid medication, then her thyroid medication does typically need to jump up by 20 to 50%. So that's something we're really closely monitoring. And then, ensuring that mom's on a good prenatal right from the start. And if I only had two things, that would be it. It's like thyroid and a good prenatal.
Okay.
And I always kind of like, we're minimal in that first trimester because so many moms are just like struggling to take anything. But then that second trimester opens up and we have a lot more. So as we kind of go into the second trimester, this is the time of blood volume expansion. So we are doubling in our blood volume. And this is when moms start to struggle with anemia. And a lot of moms will need to start taking an iron supplement. We know that iron is so important for brain development. And mom's iron really kind of sets that stage for baby's iron. And especially when we're doing delayed cord clamping, which we can talk about, and other things of that nature. So we need to ensure that we're kind of looking at iron, monitoring iron. We also, during this phase, will do things like the gestational diabetes screen. And there's things that I'll talk to moms about that, the pros and the cons of like doing the glucola drink and other things of that nature. But either way, we want to make sure that mom has good blood sugar management. And I really think this comes down to adequate protein. So we talked a little bit about like plant-based fibers, and that really helps to support the diversity of the microbiome, which has been shown to have impacts on mom's microbiome, baby's microbiome, reduces, risk of asthma and allergies in the baby, other things. But we also need a lot of protein. And most moms are not taking in enough protein. We are building a baby. This is going to prevent from like that swelling that moms experience. This is going to help stabilize blood sugar. And so protein is something that we really try to increase in that second trimester as we're gaining a little bit of the appetite back. The other thing that I will talk about, and this is a conversation I have like throughout pregnancy and throughout that preconception time period, is what is going on with mom's immune system. So as a provider who specializes in autism, what is not well known, and I hope that this is going to change over the next couple of years, is that the greatest risk for autism is if mom experiences some form of immune activation. So her immune system becomes inflamed. This could be autoimmunity, this could be asthma, this could be allergies, this could be an illness, the flu, COVID, something of that nature, and a more significant illness. This could be an infection, a gastrointestinal infection or a vaginal infection. And what happens, there's like two main kind of ways that this impacts baby. There's others than this, but these are the two main ones. Mom develops an elevation of these inflammatory molecules called cytokines. These cytokines are transferred through the placenta into baby, and they will then activate these cells within the baby's brain called the microglia. And these cells are very responsible for kind of setting up that early architecture of our children's brains. And if they are inflamed, if they are activated, they do not do their job as well. They do not help with kind of tearing down old pathways that we need to get rid of and building up new pathways. And so this idea of microglial activation is something that I'm very passionate about, and doing certain nutrients to support moms. We can't go through pregnancy always without getting sick or something happening. And so what can we do in the event that we are going to experience an illness or something of that nature? And no, Tylenol is not the answer. And so that's the other, part of this, is that we now have a huge class action lawsuit going on around Tylenol use in pregnancy and the risk of autism and ADHD and reproductive concerns. So what are the other things we can do to kind of safeguard baby's brain in the midst of immune activation? The other thing that we know to be true is that there are some moms harbor these things called anti-brain antibodies. And this is kind of newer research, but we believe that moms can then pass on, well, we know moms can then pass on these antibodies, just like she passes on every other one of her antibodies.
Mm-hmm.
And these can then attack baby's brain. And so this one has always been hard for me because up until now, we really have only been able to test for this in research. In 2024, we're going to be able to use that clinically, which I'm really excited about. And the hope is that not that we would test moms in pregnancy, but we would be able to use this in the preconception time period to then identify which moms are susceptible to having these anti-brain antibodies and what can we do to lower them or get rid of them so that we don't have to worry about that in pregnancy. But the immune system is huge, and it's something that's no one talks about. And so there's lots of things that we can do to kind of, choline is one that's shown to minimize the impact of illness. And sulforaphane, melatonin, zinc, quercetin. There's so many nutrients that could be used to kind of minimize that impact on baby's brain.
And so are we seeing a spike in some of these conditions like brain?
Oh, yeah.
What is the ultimate kind of reason for these? I know this is hotly debated, but do you feel like it is an autoimmune response that is the primary driver of some of these?
I feel it like the primary. So the one big truth about autism is that it is not one condition. Okay. And so we have probably, like, we could lay out 50 different causes or contributing factors, and it's always multifactorial. There's never, there can be one single gene mutation that leads to a condition that is associated with autism-like symptoms, but that accounts for a very small portion of children with autism. So the majority of these are multifactorial. There's a combination of genetic susceptibility and environmental triggers. And I guess I believe that the immune system and these kind of alterations in immune function is a big foundational piece in the majority of kids. And and I do think that probably the majority of kids, it's the main part. But there's definitely other, pieces of the puzzle than just immune activation, just inflammation or autoimmunity. But we know really that's where the majority of the research is. Definitely certain nutrient, deficiencies. And so folate and B12 and carnitine have all been studied separately and shown to have like really big impacts on brain development, speech development. But the inflammatory aspect of this, because we can't get into the brains and measure inflammation, we can only do this like post-mortem. It's really hard for us to be able to kind of quantify this and what treatments are helpful. But really, when we look at the literature and we were just take it down, I don't know the exact, but I would estimate at least 75% of the research in autism is related to alterations in immune function.
In utero or after birth or both?
Most of the research is actually in utero, just because they talk about maternal immune activation and not aggravating children. But we know that even with regression, so kids that are typically developing and then regress, lose language, lose the eye contact, et cetera, it's oftentimes preceded by a high fever. So again, that's just another sign. When we have a fever, the fever is not the cause. The fever is an indication that there's high inflammation.
Right. So interesting. So what, you hear about all these things, and I don't know if they're old wives' tales. I don't know if that's, acceptable to say anymore, but where, you can do things while the baby is in utero to enhance brain's function, like silly things like sing to them or put put headphones around mom's belly so that baby can hear music. Are there things like that you kind of hear through, passed down through generations that are true? And what are some of them that are probably not true?
Those are good questions. I have not gone into the literature to figure out, are they able to hear that? They are able to hear. We know that they respond to our voice and to other things. And I think that there's probably truth. We are, one of the biggest things that we see in autism is this lack of social connection. And so anything that we can do throughout pregnancy and early development is further foster that connection, that oxytocin, I think is going to be helpful. So I think I don't know that we have like a whole bank of research to show one way or the other, but I think that those things like, why not do that? Why not talk to your baby and just be connected to them energetically from the time that you conceive? I guess where I'm focused on, I'm very like research, come from research, very left brain. So it's like physiologically, what can I do to support brain development? So that's what I, talk about with certain nutrients, omegas and choline and certain things. Like I nerd out on that and I know a lot about it. I don't know as much about like, there's a couple, actually one thing that I will say, just because it's another thing that as a first-time mom, I got pregnant with my daughter. I did not do proper preconception support. I had been struggling with different fertility issues and I did not think I could get pregnant. And so that was a total shock for me. And we learned a lot of lessons through that. And, there were health concerns and I don't have necessarily like guilt about this, but I would wish, I could go back and do differently. And I definitely did things way differently when I conceived my son. And so, but one of the things I remember is that I wanted to have my daughter early. I was convinced I was going to have her at 37 weeks. I wasn't going to go to 40. Like I wanted to have her early and I didn't have her early, but I was almost like, trying, I'm like, do I kind of push this? Do I kind of find some way to induce this naturally so that I can have her? Because I was so anxious to meet her. And I've actually had a lot of moms in my practice that we look back on their pregnancy and they were in that similar position. So I know I'm not the only one who was like, I want to have my child early. I want to have them at 38 weeks. I want to get them out. I want to be with them. And what I realized, like after I kind of really started down in this road of neurodevelopment, is that those last 3 weeks are so critical for neurodevelopment. We don't want to have our babies early. We want them to go to 40 weeks. I'm okay if they go to 42 weeks, like the more they're in there, the brain is really fine tuning at that stage. And it does that best in the womb. And so that's just, another thing where I think just, certain things that are very tangible, they don't require a lot of effort. It's just like, don't induce, let your baby go full term. Things like delayed cord clamping is very big practice in midwifery, but it's kind of not, it's ignored in, general medicine. And yet we have a lot of research that supports iron levels throughout early development. It supports neurodevelopment. And so what I, aim for my patients is try to delay that cord clamping by 3 minutes or more. If you can make it to 90 seconds, great. But if you can go to 3 minutes and more, that is shown to be helpful from a neurodevelopment standpoint.
Is there the carrying to term or, full term is an interesting one because I haven't heard that before. What are there studies that show that there's a correlation between how long you what the
definitely. I mean, more so when we're talking about like preterm children, babies, so prior to 37 weeks,
sure,
there's a big risk. And there's a number of studies that are looking at premature children and how do we support neurodevelopment because we know that they're going to be impacted by that. But yes, even I think you are at term at 38 weeks, but we just know scientifically that those last weeks, what's going on is that further brain development. And so there's not the same amount of research to show there's a huge difference between like 38 and 40 weeks. But I personally believe that we don't want to intervene with this process at all. I think if baby comes at 38 weeks, then don't be anxious about it, but we don't want to manipulate it and have early if we can let them kind of stay in the optimal environment for longer.
It would be interesting if there was some kind of study that showed the difference between 38 and 40 or 41, and if there were any significant developmental issues associated with that, because there is so many doctors out there that's like, you know what, we're just going to get this done at 38. Let's induce. And, it always did feel a little weird to me that was the case.
I mean, there's research about induction and it's a little controversial, but induction is Pitocin and Pitocin is oxytocin, and oxytocin potentially can impact the way the receptors function. And again, we want to have adequate levels of oxytocin and adequate, sensitivity at those receptors, because that's going to foster that social connection. So that's not like super concrete, but it's one thing that I do ask parents, did you have, common things in labor that we know could impact development are oxytocin, fentanyl, something for pain relief. And so those things are, if we know better, we avoid, but a lot of moms don't know better. And we trust our doctors that they do. And it's not that they are misinformed necessarily. It's just that they might not have the foresight to think about how this impacts baby in these ways in the future. They're looking at APGAR scores. Is mom alive? Is baby alive? Are they going to stay in the NICU? And if those, impacts are not, or if those kind of factors are not impacted, then there's no risk.
Right.
In their world, in their contained world, in their bubble, there's no risk.
Yeah. So what if you could change one thing, just snap your fingers, change one thing to reduce some of these kind of neurodevelopmental issues, what would it be?
No Tylenol in pregnancy.
No Tylenol in pregnancy is the one thing that you do. Interesting. And you mentioned Tylenol before and kind of passing, but tell us more.
I mean, that's the one where there's a huge class action lawsuit going on right now for Tylenol use in pregnancy. They want to put a black box warning on it to say that this can cause reproductive neurodevelopment harm, because we know now that it can be associated with various reproductive abnormalities in the kids, but also autism and ADHD. And I think it's simple. It's simple step, right? So there are other things that I'd like to do, but it's going to take a lot of buy-in and policy change and information, and not everyone's going to be comfortable with it, but this one, it's we have enough information to know better.
Yeah. Okay. One more question on that then is, if you could do one study, you don't have to worry about the cost of this study, but you want to do one study. You said you're a study nerd. What would it be? What would you want to test?
Well,
oftentimes what we found in talking to some of our past guests is some of these studies are funded by organizations that have an interest in how the study, the outcome of the study, the conclusion of the study. And so, there's not enough studies out there where there is, kind of non-interested parties, if that makes sense, who are funding these things. And so I'm just curious, what would the study be that you would fund if you could fund any study? So
this is what I would say, and it's a little bit big, but we know, again, going back to what is the most well-known risk factor in pregnancy is this thing called maternal immune activation. And most of the studies are around illness. Okay. So getting some form of illness that's associated with a fever. So I do want to, just so we don't have a bunch of anxious moms, know that if you get a cold or a minor illness where you have a sniffles and you're at home, that's not a risk. We're talking about a big inflammatory response. The more significant the illness, if you're hospitalized, if you have a fever for, 7 days, we see that as a more inflammatory response. Okay. So there's a greater risk associated with that. But again, maternal immune activation, we could talk about this in other ways. Autoimmunity, we could talk about it as stress and trauma. We found that anything that elevates those cytokines could then have an impact on baby. And boys are way more susceptible to this. So for whatever reason, boy brains have a greater sensitivity. So, that kind of changes the risk profile a little bit as well. But my belief, again, this is kind of done through various different studies that have kind of looked into this, but not in there's not enough of we haven't gone far enough, but we know there's certain nutraceuticals that could be really helpful. So I mentioned choline. Used and seen that maternal choline levels are associated with improved neurodevelopment outcomes, and that if mom were to encounter something like even marijuana or alcohol, it decreases risk around that. So sulforaphane is another one of my favorite ones, but I would like more studies around a kind of a combination of these nutraceuticals and seeing if we're able to offset that impact in baby. And,
Mhm.
just because I've pieced this together for my patients through like reading a lot of literature and what I believe to be impactful. But we don't really have the data to say like this
Sure.
combination ameliorates these effects. So that's like probably one of my primary interests right now. And then the secondary thing is now once we're able to test these autoantibodies, which for these moms, these autoantibodies that they pass on to babies are believed to cause the most severe forms of autism associated with intellectual disability. And they will never use this test in pregnancy, which I personally value. They will only use it in the preconception time period or in the post, with a child who is struggling and in their mom. But what can we do? Because I believe, again, many of the things that we kind of employ for autoimmune conditions should also work for this.
Mhm.
And many of the things that we employ to kind of reduce the inflammatory cytokines should also work for this. But I would like to kind of test this and see if, a certain strategy that I have in mind is capable of reducing bodies.
I love that. So you're in California?
Yeah.
Or do you only see others in California, or is there
No, we see
state
patients.
licensing stuff that?
Yeah, sort of. I see everyone in California from a medical standpoint, and then
Okay.
I'll do consulting with patients who are in states that are not under a
The compact or
licensing.
whatever.
They're not licensed by naturopathic doctors. Yeah. And we'll do consulting. There's limitations in what we're able to do, but there's still a lot we can do in the preconception time period and perinatal time period. Yeah.
And where do we find you?
You can find me. My handle on Instagram is dr.Ari Calhoun. That's ARICALHOUN.
Mhm.
And then my website is wholesomebrainmedicine.com.
Awesome. And one of the things that we are huge advocates of is creating price transparency in healthcare, given that most people go to their doctor and have no clue what it's going to cost. And so the question for you is, are prices for what your services online, or do we have to call for those, or how does that work?
They're online. I value
Awesome.
that too.
Yes. We love it. Thumbs up.
Yep.
Dr. Ari Calhoun. This is so good. Thank you for informing us. No Tylenol, people. No Tylenol.
Tylenol.
Thank you, and happy holidays to you.
You too. Thank you for having me.
Bye-bye.